Welcome to your Aged Care Compass podcast. We help you make sense of the Australian aged care system by having conversations about topics you've asked us about. We're joined by thought leaders, professional experts, and people just like you and I who talk about their experience in the aged care sector. Hello everyone, and welcome to today's episode of the podcast. I'm joined by Professor Trent Toomey today. Trent is the National President of the Pharmacy Guild of Australia, and he's also a prescribing pharmacist and Cairns local. Trent has been practicing pharmacy for nearly 20 years and has been instrumental in increasing the range of services on offer at local community pharmacies. Trent, welcome to the show.
Thanks, Coral. Pleasure to be here.
Tell us about the Pharmacy Guild of Australia. What are the core functions of the Guild?
So the Guild is approaching our centenary. We've been around since 1927, and we represent Australia's 6,000 community pharmacies. So we were established as a national body to represent local community pharmacies and the patients that they serve with the newly established federal government in Canberra. Because all the way back then, we're talking in the interwar period, there were state-based entities that dealt with state and territory governments, but there was no national entity to communicate with the federal government. So we've been around longer than the Pharmaceutical Benefits Scheme. We've been around longer than the Medical Benefits Scheme. And in fact, a lot of the medical bodies, nursing bodies and health bodies were established long after we were. So yeah, it's an honour to be the first pharmacist from a regional area to serve in such a role.
Absolutely. Congratulations. So Trent, you've said the community pharmacy is undergoing a once-in-a-century evolution, evolving from the traditional dispensary-only model to become a more holistic health hub. What does this look like?
Well, to be honest, we've looked at the nursing profession with absolute admiration. And if you have a look, and I know you're a nurse, so I'm preaching to the choir here, Coral, if you have a look at how the nursing profession has evolved, let's just say since World War II, to pick an arbitrary line in the sand. And we now have assistants in nursing. We have enrolled nurses, we have registered nurses, we have nurse practitioners, and we have midwives. And it's just such a remarkable evolution of the profession putting their hand up where they saw an unmet need and say, you know what, we can help with that. And we will retrain and reskill, and we will work with others in the primary healthcare team to be more and provide more. And that's exactly what this evolution of community pharmacy is. But unlike the nursing profession, where the majority of your amazing profession work within state and territory government facilities, the majority of community pharmacists work in primary care and in private practice. So our 6,000 access points are the most accessible piece of primary healthcare infrastructure in Australia, bar none. We're open earlier, later and longer, and we're spread not just in the capital cities, but in regional, rural and remote Australia. And the fact of the matter is there are 300 communities in Australia where the local community pharmacy is the only access point. So what this latest evolution is, we had a look at the services that community pharmacy can provide their patients in other countries. And not all countries that Australians would look at and say, yeah, they have a similar system to us. And I'm talking about the provinces of Canada. I'm talking about the constituent countries of the United Kingdom, like England and Scotland and Wales. And I'm talking about New Zealand. And the pharmacists in those countries, working in the pharmacies in those countries, can provide so many more services. So what we did is we said, how can community pharmacy step up to the plate just as our nursing colleagues did? How can we meet the unmet expectations and the unmet need that's in our healthcare system? And the reality is people are waiting too long in emergency departments. They're waiting too long to see a general practitioner. And that's for everyday health conditions like getting hormonal contraception or a short course of antibiotics for an uncomplicated UTI or travel medicine. And it's also long-term condition management such as asthma and diabetes and hypertension and chronic obstructive pulmonary disease. So we're just saying we want to be the best pharmacists that we can be. We want to practice to our full extent of our scope of practice so we can provide those services to Australians where and when they need it.
Am I sensing some excitement in your voice, Trent? Because that sounds very exciting to me.
It
I
is
think we've
exciting. And as you said in your introduction, I've been a community pharmacist for over 2 decades. And this has reinvigorated not just me personally, but
yeah,
my colleagues as well, because
yeah,
we are first and foremost frontline clinicians. And going back to university, and it's been a while, Coral, since I went to uni. So a lot of it now is done digitally. There's a lot of online learning. There's no printing off assignments and walking down and putting it into a box. And also a big part of this extra training is working with our general practitioner colleagues so they can teach us the extra clinical skills that we need to be able to provide these extra services. And that's just so professionally satisfying, which is why we've seen thousands of pharmacists right around Australia now in every state and territory put their hand up to go back to university and retrain.
absolutely. So the Pharmaceutical Benefits Scheme began in 1948 with free medication for pensioners. Since then, the scheme has evolved, and today the government subsidises the cost of medicine for most medical conditions. Who is eligible to receive subsidised medicine under the PBS today, Trent?
So the system has evolved from a benefits program for war veterans to a benefit program for pensioners to a truly universal healthcare system. And it's one of the key pillars, right? We've got our hospital system for inpatients. We've got the MBS for pathology and general practice and other allied health. We've got the Pharmaceutical Benefits Scheme for community pharmacy. And now we've got this newly evolving NDIS. And those four pillars form our universal healthcare scheme. But the PBS, when it was established, wasn't without its controversy. The Pharmacy Guild of Australia supported it. The AMA actively campaigned against it back in the day, but it seems unfathomable now in 2025, moving to 2026, that you wouldn't have a pharmaceutical benefit scheme. And the purpose of it is to list essential medicines. And I'm sure you can appreciate that technology has changed an awful lot since 1948. We have a whole range of new conditions that we were able to diagnose that we didn't know existed in 1948. And consequently, we've got new treatments for these conditions as well. And people are living longer and healthier lives. And isn't that a wonderful thing? Our system is probably a balance between a free market system in the United States, which no one wants. We all are familiar with the shortcomings of the United States system, but then a completely socialized system in the United Kingdom, which has its struggles as well. So in a truly quintessential Aussie way, the Pharmaceutical Benefits Scheme has a means test about it. So those people that genuinely cannot afford, such as our First Nations Australians, those that hit their safety net, pay nothing. Those that can pay some, such as our pensioners and such as those on unemployment benefits and single mothers, etc., pay something. They pay $7.70. And for the rest of us, we pay a little bit more, albeit it is still subsidised. So we've been working with the federal government since this cost of living crisis, and the maximum co-payment for people like you and I, Coral, that don't have a healthcare concession card, we were paying $42.50 a month per script. That came down to $30. And on the 1st of January 2026, it will come down to $25. And for the pensioners and the healthcare card holders, we've been able to freeze their co-payments at $7.70. So it won't go up for 5 years. So we're really trying to make sure that the system is fair for everybody. We can afford, from a taxpayer point of view, to fund and list the new medicines. So we are one of the first countries to get access to new innovative therapies, but also that those that can't afford get a heavier subsidy than those that can afford to make some form of contribution.
Excellent. And how do people who might be eligible under the Reciprocal Healthcare Agreement go about demonstrating their eligibility?
Sure. So there are a range of countries, usually Commonwealth countries from other highly developed spaces, like I mentioned before, who have a reciprocal healthcare agreement. And if you're coming over here for a period of time to work, to study, or to have an extended holiday, you need to go and register with Medicare, and you'll be given a temporary Medicare card if you're doing a longer stay. We do have, however, when you present at a community pharmacy, for those that are just here on short-term holidays, there is a special Medicare number that can be used, that we can plug in if we can prove that patient is from one of those countries, and usually it's showing your passport. But that can only be used once, and then you have to go and get your own card. So it's a little bit easier for Kiwis because they're our closest cousins. So it's a little bit easier for them to be able to demonstrate it. But if you're from, as I said, England or Scotland or Wales or Ireland or Canada, There's some European countries as well. Then, you just need to present to a local Medicare office with your passport.
Excellent. Trent, what is the Repatriation PBS?
Well, this is something that is close to my heart. I live in Cairns in far north Queensland, and we have HMAS Cairns. And I went to university in Townsville, and I have a pharmacy there as well. And it's a garrison city. It has the 3rd Brigade and, of course, the RAF base there as well. So a big part of being a pharmacist in regional Queensland is looking after our service men and women and also looking after our veterans. And they deserve to. And I just want to thank anyone that is listening that has been a service personnel or somebody that is a spouse or widow or widower of a service personnel. Thank you for your service to our country. So this particular system is more generous, as it should be, to acknowledge the fact that if you have served to represent and defend your country, when you leave, you can have a higher health burden. Now, whether that is something like PTSD or whether that is some form of physical trauma. So the Repatriation Benefits Scheme, or the RPBS, is more generous and more broad than the regular Pharmaceutical Benefits Scheme. Now, it has 3 different categories. You can have a gold card, which is the gold standard, and it covers not only all of the regular things on the PBS, but it covers a broader range of medications, but also a broader range of non-medical things you can acquire from your pharmacy, such as wound dressings, for example. You can have a white card, and that white card is for a specific condition. So it doesn't cover everything, but if you've got, for example, back pain, or you have PTSD, or you have something that is very specific to your service, you will get everything covered, but only for that condition. So if you're on other things that weren't as a result of your service, it won't cover those, but it will cover all of them. Then there is the orange card, and many of your listeners will not know this one even exists. Remember I said to you before that the gold card just doesn't cover medicines, it covers non-medicines as well. Well, the orange card is only for non-medicines. So it's things like wound dressings, for example. But not many people are on those. And a lot of war widows that we have also have this particular card. And it's really interesting because a lot of war widows now, a lot of war veterans are not older people. We used to think it was that when I first started practicing, they were the World War II widows or the Vietnam widows. But now we've got, of course, the Gulf War, the 2 Gulf Wars. And so there's been a lot of times Australians have served overseas now, and we're looking after younger and younger families.
Yeah. And Trent, if a person can't afford the co-payment for the cost of their PBS subsidised medicine, is there an option to have that co-payment waived?
No, so co-payments are mandatory, and you cannot waive co-payments, you cannot discount co-payments, which is why it's so important that when the Pharmacy Guild is having these conversations with the federal government, we make sure that we balance the cost of living together with the capacity to be able to pay. So this is why we have a 3-tiered system: free, a small copay, and then a larger copayment. And if people's circumstances are changing, they can go and apply for a healthcare or concession card through Centrelink. And we have a lot of patients who are on temporary short-term healthcare and concession cards to cover short-term cost of living crises. So if you're out there and you're struggling, then go have a chat to Centrelink and maybe you'll be able to go on with these cards. And that will make, instead of your medications being $25 each, they'll go down to $7.70. But remember, there is also the safety net. And if you spend a certain amount of money on medications, and there's a different threshold for concessional patients and general patients as well, then your medications become free for the rest of that calendar year.
That's fantastic. I was completely unaware that you could get a short-term healthcare card.
Yeah.
In fact, I'm really glad you raised that point because I don't think I'd be the only one that was not aware of that.
They are means, like, for example, if someone's on a pension card, once you hit 70 and you get it, you're not getting any younger. So that's why they give you a 12-month one and you get a new one every year. But we find healthcare cards, they have a much shorter date. We've had ones that have had 3 to 4 month expiries, ones that have had 6 months expiries. But again, that's not something your local community pharmacist can help you with. That's a conversation you have to go and have with Centrelink.
Yes, of course. Trent, you just touched on the safety net. Can you just enlighten us a little bit more about what that means?
Sure. So if you are one of the Australians that are already getting it for free, this doesn't apply to you because you can't get any cheaper than free. But if you're one of the group of Australians that are paying $7.70 because you're on some form of healthcare or benefit or concession card, it is everyone in your family unit. So every person that appears on your green card counts towards a safety net. And once you spend $277.20 in a calendar year, you will get issued an SN or safety net card, which will drop the price of those medicines from $7.70 down to free for everyone on that Medicare card for the remainder of that calendar year. And then it starts again on the 1st of January the next year. If you are a general patient who is paying, as I said, $25 from next year, there is still a safety net. It's much higher though. It's around $1,400. So not many people hit that $1,400 safety net. But if you have someone in your family who is going through a temporary health condition, so is really using the healthcare system an awful lot, then that may be of something that's a benefit to you. Now, the good thing about this particular one, Coral, is this is one your local pharmacist can do for you. It's not one you have to go and talk to Centrelink about. So the trick here is if you always go to your local community pharmacy and you have one pharmacy and you loyally use that one pharmacy, make sure your pharmacist has everyone on your Medicare card linked, and then that local pharmacy will automatically issue you that card. Now, if you sometimes go to other pharmacies, you will still get the safety net, but you have to collect it. It's your responsibility to do so. And you will have to present all of your receipts to a pharmacy, and a pharmacy can then issue the card for you.
Okay, great tip.
Community pharmacies keep Australia healthy. With 6,000 locations nationwide, they're open early, late and longer for convenient, accessible and safe care. Pharmacists provide home medicine reviews, dose administration aids and essential vaccinations. Thanks to additional training, many can now treat common conditions like ear infections, wounds and skin issues. They also support management of chronic conditions in partnership with your healthcare team. Ask your pharmacist how they can help you and your family stay well.
So what are some of the more common health challenges that elderly patients bring to their local pharmacy, Trent? What do you see?
Well, we're living a lot longer, aren't we? And this is always the balance between quality and quantity. And we want to make sure that we can help people not only live as long as they possibly can, but we want them to live as well as they possibly can for as long as they can and in their own home. And one of the big challenges we have, Coral, over the coming decade as we move towards the 2032 Olympics is we simply don't have enough residential aged care facility beds for every Australian that will need one. So we are going to have to, as a country, learn how to provide extra services for Australians to age in home. And that's where your community pharmacy becomes so important. So what we did, and you said in your introductory remarks that pharmacists like myself have gone back to university to retrain and to upskill, it's to provide these extra services. It's exactly what we're doing. So I can now diagnose and treat cardiovascular disease, so hypertension, type 2 diabetes, non-insulin dependent diabetes, dyslipidemia, so your cholesterols, if it's not quite being looked after. We've got chronic obstructive pulmonary disease, asthma, arthritis and musculoskeletal pain, chronic pain. But there are still many things that you will need to see your GP for. And these extra services, Coral, do not replace a GP. I just want to make that point. It is very important for every Australian, whether they're aging or not, to have a relationship with a really good quality local family physician. But what these extra services pharmacists do is we can work with your local GP because you might not be able to get in with them as often as you'd like or as often as you can. And that's where pharmacists working with their GP, the local community pharmacy working with the local general practice can really add value to people aging at home.
Without a doubt. Look, I'm really intrigued by this, Trent, and I just wanted to ask you, how do you know if your pharmacist is one of these extra services pharmacists or pharmacies? How would you know that if you were going to engage or if you wanted to have a discussion with your local pharmacist about perhaps a diagnostic pathway or
That's a great question. So the pharmacists at the moment, these extra training programs and these extra accreditation are controlled by state and territory governments. But all of the health ministers got together in June and said, listen, we need a national approach to this. So they've tasked the Pharmacy Board of Australia to nationalise this process. So in the future, and when I say in the future, we're talking less than 12 months, right? So I'm not talking in a long period of time. You'll be able to go to the Pharmacy Board's website and you'll be able to look up Trent Toomey. And on there, it would say Trent has extra qualifications. So just like there's the nursing board, Coral, right? And it doesn't matter whether you're an EN, an RN, an NP, or a midwife, you're all on the nursing board and the midwifery board. But I can go on there and differentiate between Coral as a nurse or Jane as a nurse and see what her different skills and qualifications are. It'll be the same for a pharmacist. But listen, to specifically answer your question today in 2025, at the moment, the only jurisdictions that have graduated practicing pharmacists are the Northern Territory and Queensland. Whereas across 2026, they're all in training. So all of next year, we will see the first cohorts graduate in New South Wales and Victoria, Western Australia, South Australia, Tasmania. So the rest of the country will all come on board in 2026.
I'm guessing there's been quite a lot of interest from pharmacists in these, I guess, for want of a better term, extra credentials.
Yeah.
Particularly in, I guess, rural and remote areas as well, Trent. So, I mean, I don't know how many pharmacists who have gone through this extra training and education are, I guess, how many are going to be coming out into the community next year, not in the Northern Territory and Queensland?
No, we're talking about nationwide now. That's a really good question. So there are 40,000 pharmacists in Australia. 2/3 of those work in community pharmacy, and the other third is spread between every other area of practice, right? Namely hospitals, but also some other bespoke areas of practice. So my job as the president of the Guild is to represent the 2/3, the vast majority of the network that are working in community pharmacy. Now, our goal, our big, hairy, audacious goal is that by 2035, 80% of local pharmacies and 80% of community pharmacists will be trained to provide these extra services. We're working closely with all of the universities now to embed these new skills and qualifications into the base degree. So every graduate that will come out, right, from 2027 onwards will have these extra qualifications. And that's exactly what they did in England and Scotland and Wales and Alberta and all of those other jurisdictions in those other Commonwealth OECD countries, because we need to make sure that this isn't something you have to go searching for, right? And just as it was only a decade ago, pharmacists weren't vaccinating. And now we are the biggest provider of vaccinations. And almost all pharmacies and almost all pharmacists now are vaccinating Australians. And so that's what we need to do. That's why I said to you, and you said in your introductory remarks, this is a 1 in 100-year transition. We are fundamentally changing the services that all Aussies will be able to receive from their local pharmacy.
That's amazing. Trent, tell us about the Home Medications Review Program.
So the HMR program has been around for many decades, and it stands for Home Medicine Review. And basically what this means is a pharmacist will come and visit you in your home. And to receive this service, it needs to be referred by your local GP. The service is completely free for you. You can have one every 12 months, and the pharmacist will obtain all of your history from your local pharmacy, from the local hospital, from your local GP, all of your pathology results, and they will go through all of those results before they come and see you. So when they come down and have a cup of tea, sitting at your kitchen table with you, and you'll be able to get out all of your medications that you take, and not just the ones that you get prescribed from your GP, but the ones that are prescribed from your specialists. You'll be able to get not just all the medicines you get from your pharmacy, but all of your vitamins and minerals and everything else that you're going to be able to put it all out on the kitchen bench and have a chat with the pharmacist. And they'll go through the entire thing with you. They'll help answer any questions. They'll help do an audit, and they'll do that report. And that report is made available to you, but it's also made available to your local GP. And this is to make sure that you're on everything you need to be on, but nothing more. And the most common recommendation we get from home medicine reviews is actually to discontinue things, not actually to go on more things. And though we are the medication experts and we want you to be able to be on everything you need to be on, we don't want you to be on anything more than you need to be on either. And that's why this program is so popular.
It makes me wonder, and I'm sure it happens probably too often now, the pharmacists that are going into people's homes to conduct an HMR, how often does the older person then pull out their spouse's medications as well, or even admit that every now and again they might be taking their husband's medications as well? Because that's what I used to see when I used to go into people's homes as well. It was really concerning.
Well, we need to make sure that healthcare in Australia is not just delivered in a doctor's surgery or in a pharmacy. It's delivered in place where you live, because you don't age and live in your GP's building. You don't age and live in my pharmacy. You age and live in your own environment. And a healthcare system that is responsive to your needs will go out to where you are, and it will help tailor something specifically to you.
Yeah. So, Trent, what are the benefits of having an HMR?
Well, the benefits of having a HMR is so it puts you in the middle of your healthcare, and it's so the left hand knows what the right hand's doing. And I said before, it's to collate all of the information, both pathology, radiology, discharge summaries, because often people have been in and out of a hospital, and the general practitioner's records and your local pharmacy's records. And it is basically a piece of communication that helps put a consolidated report from all of those different areas back to the person that is helping manage your healthcare. And so it's an annual audit. It's not just an annual safety audit to ensure no harm is given. It's an annual optimization audit to make sure that all of those people in your team are getting the best results for you.
And there's a similar program that is offered to people living in residential aged care facilities, which is the Residential Medication Management Review. How does this differ, if it does differ, from the community program?
Well, so the RMMR program is slightly different. It is essentially still an audit, but it acknowledges that when someone is aging in facility as opposed to aging in home, there are different players in your system. There are the residential aged care facility themselves, right? And we need to make sure that the report that we spoke about doesn't just go to you, because remember, this is not about talking about you around you, right? This is helping strengthen you as the middle of your healthcare. There are other people to communicate with. So we need to communicate with the nurses that are running the residential aged care facility, right? The nurses in the nursing home, funnily enough. It's a different program because it has different business rules. So rather than the pharmacist going out to one home in this suburb, then another home in that suburb, then another home in this suburb, they're going and doing a couple of hundred people over a few days in one facility. So it's still doing that audit. And sometimes, remember, we have low care, medium care, and high care in these facilities. Some of the patients can't communicate, right? So that the auditor, the HMR pharmacist, needs to communicate with other people in that healthcare team, because often those high need patients can't communicate. So it is to help do a similar thing, but for people in different environments.
Okey-doke. So talk us through the 60-day dispensing and the impact this might have on elderly people. What are the pros and cons for an elderly person receiving a 2-month supply of medication?
Sure. I mean, who doesn't love 2 for 1? But sometimes 2 for 1 isn't 2 for 1, right? So if you are a self-funded retiree, not somebody who is on a healthcare or concession card, sometimes it is not 2 for 1. Sometimes it's 2 for 2. So you're paying twice the amount for twice the amount. So if you are on a healthcare or concession card, though, usually it is twice the amount for the same price. So we just need to make that differentiation. Sometimes if you are in a facility, you are getting your medicines packed. So there's no real safety issue that we've got with you being on a 60-day dispensing. If you were at home, though, some medications we worry about having an increased number sitting around in medicine cabinets at homes. It's not just because it can provide a safety risk for grandchildren or confusion between spouses. It's also some of these things can, if they're not stored in the proper conditions, can degrade at a quicker amount. But listen, there are some people that it is completely appropriate for. So some that are very stable, have been on the same thing for a very long time, going and seeing your pharmacist 6 times a year instead of 12, that can save you some money. What we just need to make sure, though, is that it's the right medication for the right person, and it's not giving people 2 months' worth as they've been discharged from hospital and they've just had their circumstances change, because that person requires monitoring more closely for a few weeks. Then we can drop it back to a few months, and then they become stabilized, and then they can go on 60-day dispensing. So unfortunately, we're seeing a lot of errors in doctors writing 60-day scripts, specifically out of hospitals upon discharge for people that have just had some form of adverse events. That is a clinically inappropriate time for 60-day dispensing to be written. But it is completely appropriate for a GP to write a 60-day dispensing script for someone that is stable and is on a long-term med. So we just need to make sure it's the right prescription for the right person at the right time.
Absolutely. Trent, why is it important that elderly people receive their annual vaccinations?
Well, as we age, our bodies are like a Formula One race car. They're not as fine-tuned as they used to be. Sometimes after you've got a few kilometres under the bonnet, the machine's purring along quite nicely. But other times it's a collector's edition and we need to treat it with a little bit more care. And a lot of infectious diseases, whether it be the annual influenza, whether it be an MMR, so measles, mumps, rubella, whether it be whooping cough, especially if, you're a grandparent or even a great-grandparent, we need to make sure that not only are we vaccinated as we age against things that can be threatening to us, we need to make sure that we maintain our vaccination status for other vulnerable people that we would like to spend time with as well. So when it comes to vaccinations, we're worried about the very old and we're worried about the very young. And as I said to you before, community pharmacists are the number one providers of vaccinations in Australia now. Yeah. So there is no difference in the vaccinations that you can receive from a GP, from a nurse practitioner, or for a community pharmacist, and they're all covered. So there's the National Immunisation Program, which means it is free. So things like the flu shot, like shingles, like COVID-19, they're all free for you from your local pharmacy. And even the immunococcal vaccination, if you're over the age of 70, that's free from your local pharmacy for you now too. So we make sure, Coral, that whatever vaccination we provide you in pharmacy, it's all uploaded onto the Australian Immunisation Register, which means it pre-populates your GP's records as well as the residential aged care facilities records. So it's just, you don't need to worry about getting a service from a pharmacy and other people in your healthcare team not knowing about it, because in order for a pharmacist to participate, we have to upload that record.
Okay, excellent. Trent, what changes would you like to see in a pharmacist's scope of practice to better support elderly people?
There are 6,000 community pharmacies in Australia and 40,000 pharmacists. But guess what? The better number, Coral, is the 27 million Australians we are meant to serve. And no two communities in Australia are the same. The healthcare needs of the communities that I serve in tropical far north Queensland are different to the communities in Hobart that the community pharmacists are serving down there, and in Canberra and the community pharmacists are serving there. So we need to make sure that the services we provide meet the needs, expectations, and preferences of the communities we are meant to serve. So sure, there needs to be a generic base skill set that all community pharmacies have in Australia for national consistency. But if infectious diseases, tropical medicine, and dermatology have a greater demand in tropical North Queensland than they do down south, whereas pollen, allergies, and other conditions that they have a greater demand for down south, then they are going to specialise in those and I'm going to specialise in these. So, and isn't that a wonderful thing? So just as general practitioners, and listeners may not know this, but a GP is not a GP is not a GP. They all have a basic general knowledge, but they have these things through their college called specific interests. And there might be a general practitioner with a specific interest in child and maternal health, or specific interest in women's health or men's health. And so you can go and you can find a general practitioner that has extra training in a specific area. And that's exactly what I think is going to happen to community pharmacy. So you'll have one that specialises in mental health, one that specialises in women's health. And just as you go and find a GP that suits you and your family's needs, you might drive past 2 or 3 pharmacies and find one that has the skills and knowledge to meet your preferences and your expectations. And isn't that a wonderful thing?
I think it's fantastic. A conversation today, I feel very, you used the term before, invigorated, but I feel so excited. I think there's never been a better time to be a pharmacist. You're just doing so much and the role is just expanding so much, and certainly to meet local needs as well. Trent, I know you're very, very busy, and I just wanted to say thank you. I really appreciate your time that you've given me today. It's been wonderful having you on the show.
Thank you very much, Coral. And can I say to all of your listeners, whether you are aging in home, whether you're aging in facility, or whether you are looking after somebody who's aging, Australia's 6,000 community pharmacies are there to partner with you to help you age in the way in which you want, where you want. So thank you for your time today. Greatly appreciated.
Thank you, Trent.
Thanks for tuning in to another episode. Do you have a topic that you'd like us to cover on an episode? Please reach out and let us know via social media or our website, seemeacn.com.au. That's SEEMEACN.com.au. All the links are in the show notes. And don't forget to hit the follow or subscribe button so you don't miss any of our upcoming episodes.